Good morning, everyone, and welcome to Food Access during the pandemic, a collective approaches between local government and food pantries. This session is a panel discussion in which we will explore how local government and food pantries work together during the pandemic to ensure services to the most vulnerable in the Capital District. The discussion will center on collaborative efforts, innovation, and suggestions for successful partnerships. Our panelists today include Keith Brown, the Interim Public Health Director for Schenectady County, Patrick Alderson, Senior Policy Analyst at Albany County Executive's Office, Angela Warner, Social Justice Ministries Director at the Church of St. Vincent de Paul, Thomas Schofield, Manager of Food Justice Initiatives at Schenectady Inner City Mission, also known as SICM. So thank you to our panelists and thank you to our audience for joining us. So let's get started. So I would ask in our first question, in your professional opinion, why is it important for our municipal government and local charities to work together? Why don't we start with Tom from SICM?
Thank you, and thank you for hosting this wonderful endeavor. I think one of the things that we saw come to fruition during the pandemic was communication from the county and state governments. We were able to establish protocols based on their information. Also, health advisories. That information was entirely critical to for us to maintain being open, as well as being safe. One of the things that came out is we learned about the safety nets throughout the county, and we were able to take part in making sure that his food and supplies were evenly distributed throughout Schenectady County. One of the things that really helps us out is, the partnering with the county, partnering with the state, and with the federal government is, it really helps because it allows a more efficient outreach when you partner with the charities, allowing for delegating to the charities really helps both sides, number one, save money at the county level, but number two, helps us because we have the boots on the ground, we have the outreach. So I think that is a great way that we worked together, especially to help save resources at both levels so that we're not all running all over each other. And we were able to really get involved down the road thanks to Keith and his team. And so from there, I think that we were happy to work with them in the future with distributions. And now we know that we need to have these safety plans, and the community at large has to be involved in those safety plans.
That's great. Thank you, Tom. And as you mentioned, Keith, why don't we throw it over to Keith?
Sure. Yeah, and thanks for having me. This is really great. So I come from the nonprofit world. So for me, it was really incredible for me to join municipal government and really learn about all the different resources that municipal governments really have. And so for us, that was really an incredibly useful tool, right? As everything was March and April, as things were getting really, really intense. For us, we had resources, and at the same time, county government was also starting to move towards remote work, and we were shutting down our offices, and things were sort of grinding to a halt in a lot of the municipal services that we provide. So for us, it was a really natural way of taking those resources and then dedicating them to what the priority for all of us was at the time, which is to make sure that our communities are safe, that families are safe, and that we're really delivering the things that people need to survive during kind of all stages of the pandemic, but especially when things were shut down. So, we worked with partners in the community to mobilize an enormous emergency food and other needs distribution center out of the Boys and Girls Club. We did 16,000 deliveries to almost 8,000 unique households. I mean, those are just a couple numbers. We had 27,000 calls into the hotline. We made 1,600 referrals to external agencies. I mean, those are enormous numbers for a county with 155,000 people, and we couldn't have done that without partnering with all the organizations that pitched in, and we also couldn't have done that without mobilizing our probation department, our library staff, our highway department. All of those folks were involved in emergency food and other needs distribution. So when it's all hands on deck, it literally has to be all hands on deck in terms of the resources that people provide. And Tom's right. We I know we're going to get into what we've sort of learned out of this, but we really learned that people can partner and step up and make an incredible difference, much more so than anybody could as an individual entity.
That's great. Thank you, Keith. Angela, how about you? And just so people know, St. Vincent de Paul is based in Albany County.
Yeah, I think it was instrumental to be partnering with the food pantries and the county. Early on when the pandemic really started happening, we already had an infrastructure of delivering food to the people who frequented our food pantry because we provided rides home. So we had a system in place to be able to support the county in Albany to deliver food to residents around in different communities around the city of Albany. And we worked with the sheriff's department, with the county, and then we continue to provide delivery services to people who are unable to get to a food pantry for various reasons. And I guess for the last couple of weeks, we've not had a COVID delivery. So we were also delivering to people who had to stay home because of COVID. And I think it was helped to create a system within the city because other pantries joined on to provide food to people who needed delivery, either because of health issues or because of COVID.
That's great. Thank you, Angela. And Patrick.
Hi, good morning, and thank you so much for having me here today and for hosting this event. Kind of real quickly, kind of piggybacking off of what Angela said, I mean, I think that it was very obvious that there was an identified need if we remember back to kind of the start of the pandemic, there wasn't a very robust kind of grocery food delivery infrastructure in place that would have kind of satisfied the need of not just people who were in quarantine and needing to be isolated, but also just the general public who was told to not go to stores, etc. So the county, Albany County, kind of realized from the start that we needed to be able, if we were asking people to stay home, to remain in quarantine because there was a credible exposure, then we needed to have kind of like these wraparound resources also kind of attached to that ask. Like, what if you didn't have food at home, and how could we get you these essential services quickly? And we realized that we couldn't do it on our own. We needed to work with partners. We really needed to rely on the infrastructure that existed in the community that a lot of the community members already tap into. And that would be there long after kind of the initial crunch of the pandemic, and would kind of stay there throughout the entire disaster and kind of throughout the recovery process. So that's why we really looked to nonprofits and the food pantries, the parent organization, as well as the member pantries, to kind of be that entity to kind of take over this food delivery aspect of our response, and we really appreciate the opportunity to work with the food pantries and other nonprofits. And I can only say that I think that kind of looking towards the future, we need to continue those relationships and continue to build in nonprofits and charities into planning for all scenarios in government's response.
Yeah, thank you, Patrick. And I do want to mention too, Tom did mention, speaking about outreach and more efficient outreach, because I do have to say that here in our organization, we do have a referral team, and they will take and connect people to resources. And obviously we saw our volume increase tremendously, but with our partnerships with counties such as Schenectady and Albany, we really did see more and more people call, not just for food, but also needing and wanting to be connected to other resources. And a lot of that outreach that the people were doing at the county level, I do really think helped folks connect to us to allow us to connect them to really important resources. So that outreach was critical. So that's great. Next question, just wondering, how were you effective during the pandemic, and what adaptations did you have to make? Patrick, why don't we go back to you?
Okay. I mean, well, I think a big part of why Albany County was able to be effective was because we relied on partners, but we also kind of embraced a lot of new technologies very early on. We had to transition the workforce to a remote setting, and while continuing to deliver services. We also kind of flexed a lot of employees to perform non-traditional functions. I think Keith spoke to this earlier in Schenectady. They were kind of using probation officers and highway department staff to do a ton of deliveries. The same thing was happening in Albany County. It was really an all hands on deck effort to respond to the immediate crisis, which was the pandemic, and really kind of having that flexibility to repurpose personnel and work with partners to kind of all pull in the same direction is, I think, what allowed Albany County to be very effective. And also just having open communications, borrowing best practices from others, kind of really kind of having a coordinated approach and having open lines of communication really did help.
Great, thanks, Patrick. Tom, did you want to respond to that?
Well, and I like the opening the lines of communication on that. I think that one of the things that, for us, we really needed to have good lines of communication with Keith and with various other health professionals. Because the information coming out, I think, as we remember from March and April and May, it was very convoluted information. It was two sides. Nobody really had a good grasp on it. And when you're operating in this situation, operating a pantry or operating a food source, number one, you have to keep your guests safe, but you have to keep your employees and your volunteers safe, and that was critical. Whatever information we received, we implemented right away. We were able to set up our distribution. I know Angela mentioned that they had the infrastructure for deliveries. Unbeknownst to us, we did. We had actually more infrastructure than we thought, and we were able to quickly implement a delivery system to accommodate the people that were really left out, that couldn't get to the pantry. And so that was a critical point for us, not only being able to have people come in and safely come in and have those safeguards in place for when they do. I mean, it was amazing. We started off, we would see about 50% mask wearing in April and May, and then all of a sudden by September and in through the winter, we would see almost 90%. We weren't handing out that many masks anymore. I mean, other than just personal use or taking for the family. So that was really a positive step in that regard, because we were able to effectively communicate to our guests, to the community, what they needed to do to be safe. Other than that, I mean, we were able to really benefit from the Nourish New York program. We were able to really buy and source great materials, great product from New York State year round, and that was actually a fantastic uh, endeavor us, because we were able to access these things that we weren't able to access before in mass. And so we were really able to reconstruct our pantry in that way. But one of the big things that really came out, I mean, remember the toilet paper, debacle. I can't thank Keith and everybody enough for finding and sourcing that. I mean, that is a small need, but when everyone is at home and not going out to grocery stores, not going out to stores in general, to just have something like toilet paper. And so we were able to capture a good amount from that and distribute it, and that was fantastic. So, I mean, all around, I think this was a tremendous effort on all parts. I can't thank Keith enough and his team and the whole county and the state for really doing an amazing job helping us get through this without closing, maintaining decent hours, and really pushing through. So we wouldn't have been able to do that without their information, without their help.
So. Thanks, Tom. Thank you. Angela?
So, like Tom, we lost probably 85 to 90% of our very veteran volunteers, and tried a couple of different ways to serve our guests. Now, we're a choice pantry, and we have like a space that's 1,000 square feet. So that's a big space that we can put all our inventory in the pantry. And I have to say that with new volunteers, you have clearer eyes on what might work. And probably about a month and a half into the pandemic, they all came to me and said, well, Angela, people are shopping in the grocery store. Why can't we set up, put some guidance into the food pantry so people can continue to choose? Because I got to tell you, the packing of bags made us have more work to do, because people would take out things that they wouldn't eat. And I'm a real strong proponent of choice. And it was killing me to do that, but I knew that, we had this pandemic happening and we were trying to make sure everyone was safe. But we found a way to set up the food pantry so that people could shop, and our volunteers would take the product off the shelf and put it in the shopping cart, and people were able to choose their food. The thing that surprised me, though, is people thought we closed, in spite of there being, some announcements in media that food pantries were open. But once we got that system down and serving guests, people were showing up to the pantry to shop. So we had a space that we could do that with, and we had cleaning protocols and all of that in place so people could still choose their food.
That's great. Thanks, Angela. Keith?
So, everyone really brought up a lot of what I was going to mention. I think the only other two things is that, my role in public health, if we're going to tell people to stay home because that's the safest thing to do in a pandemic, then there's actually a governmental responsibility to help people with the resources they need to be able to stay home. So, it's one thing to make a public health order that says because of a contagious public health threat, you have to stay home. But if people have to get food, they have to get resources, they have to get toilet paper, they have to get things. So for us, there was responsibility there. And then the other piece is that to make it as low threshold as possible for people. So, we made it so that people would just call the hotline, say how many people were in their household and where they lived, and we could schedule a delivery. That was it. We kept it as simple as possible. And I think, government is maybe at its best when it's just providing resources to people and doing it in a way that is as accessible and low threshold as possible.
Yeah, super, super simple. Very few hoops to jump through. I think you're absolutely right. Patrick, I did just want to go back to you for a minute. You did talk about new technologies and borrowing best practices. I'm wondering if you could just expand on the new technologies a little bit and some of the best practices that you've borrowed.
Yeah, absolutely. So, I mean, some of the can you hear me?
Yes.
Okay. I'm just getting a little bit of feedback, but in Albany County, we started to use a lot of data and to put that data in public facing dashboards. It was really kind of COVID data, public health data, but a lot of that data is also kind of informing now our outreach efforts, our public health kind of prevention efforts, as well as, or at least in the towards the beginning half of the pandemic, and since kind of January, it's kind of been driving both looking at cases, but as well as vaccination rates, outreach for generic public health messaging. And that, I think, is something that we're looking to do kind of moving forward, really kind of allocating resources where there is the greatest need, using data to kind of inform those decisions, and really trying to kind of minimize barriers to getting information out to the public, and allowing them to use that information, but also kind of minimizing barriers for the public to kind of receive as much information as possible as well.
It's great. Thank you, Patrick. Okay. Also, just wondering, were there any surprising partnerships that came out of that time period with COVID and the pandemic? Who wants to go first? Keith, why don't we start with you this time?
I think from our end, I don't know that there were a lot of surprises. I think that's maybe our community partners that were probably more surprised at what we were able to help out with, I think, maybe than we were. I mean, I think we know that we have a really robust, dedicated network of community partners. And I don't know, I think I would defer to Angela and Tom to find out what they thought about being able to partner with government, I guess, in a way that was sort of new for everybody. But for us, I think I was more surprised internally, I guess, in the partnerships within the county at how people stepped up. And we had librarians manning the hotline calls. We had probation joined us, I mean, to do food bag packing and things. We had highway doing logistics. We had other people. So for me, I think that was surprising. But externally, I'd be interested to hear what Tom and Angela have to say about partnering with municipal government.
It's great. So Keith has deferred to Tom and Angela, so we will go to them. Tom, what are your thoughts?
Well, it's funny. Yeah, that's County Health Department was at the top of my list of surprising partnerships. I think that across the county, we were able to outreach to a lot of places and a lot of people that were open. You know, we're trying to find out who needs what. We had some extra storage, we had some extra things, and you know that became kind of a little network of, hey, you've got this, I've got that, help me out. Okay, great. Not in anything major, but just little things here and there. But food pantries was a big one. I mean, for us to be able to work with the food pantry of the Capital District and really help them distribute the food, you know, take the referrals and get that out, and as well for us, the school district, communicating back and forth with them. But you know, I'd say number one really was the health department. I guess I'm lauding him, but you know, Keith and his team did a great job for us. And I know that top to bottom we all appreciated everything that came out of it, and we look forward to, you know, partnering in the future. I know with vaccinations, with a lot of other endeavors. You know, we want to be at the forefront in Snoqualmie County with food and with other services, being a hub of sorts for these things. So we're looking to reach out and to create more partners. better, more solidified partnerships, and understand the flow of need more to help kind of put those partnerships into the places that we need to have them to be effective and efficient. Defer to Angela after that.
Well, St. Vincent's is a grassroots pantry in the Pine Hills of Albany. So we're not a really complicated organization, but we're on the ground. And I think that most of the food pantries in the Capital District have demonstrated really how resilient they are. Probably in the beginning, we didn't feel very resilient, but I think once we started to figure things out and there was some consistent guidance on what needed to happen, that, people got their game back on. And to get support by the county and other governmental organizations really kind of legitimized the work that we do. We had Albany County, the chairman of the legislature and a couple legislators came to our pantry to provide some PPE to us and actually helped us with our delivery, unloading the truck from the Food Express truck. So, I think that, we're on the radar screen in terms of the role that we can play in a crisis and when people are in need.
Great, thanks, Angela. Patrick?
Yeah, and I just want to echo kind of all those thoughts, and I really do agree with kind of the idea that there needs to be kind of continued conversation and continued communication kind of moving forward. I think we've built kind of a great kind of foundation for a strong partnerships into the future, but those conversations need to continue. The dialogue between local government and nonprofits need to continue beyond this. Nonprofits need to be much more involved in local government's kind of planning. And yeah, we should listen to kind of what resources those nonprofits need, what kind of gaps they're seeing, so that if there's opportunities to kind of fill those partnerships and kind of expand out and build out the foundation of services provided in the community, then those should certainly be explored. And then I guess as far as kind of surprising COVID partnerships, early on towards the end of March 2020, the county executive kind of enlisted the New York National Guard and the Food Bank of Northeastern New York to deliver groceries or deliver kind of items from the Nourish New York program to households that were in quarantine. So that was a very effective partnership that went on for the better part of kind of 2 months before the county was able to kind of find something more long-term and centralized through the food pantries. So all these partnerships, I think that when push came to shove, we all kind of hunkered down and worked together. But I'd love to see kind of these partnerships be formalized and kind of continue the relationships into the future.
That's great. Thank you, Patrick. We do have a question in the chat. Jennifer Hatch is asking, what role did the county health department play and how did they get involved? Just wondering, Keith, if we could direct that question to you.
Sure. So, it was sort of, I guess, it was really simple for us to get involved because we were the ones putting people on isolation and quarantine. And so there had to sort of be some linkage with the folks that we were delivering to in some way. So it was sort of an evolution. So very early on, when we were making calls to people, or people were calling into our line at public health about being on isolation or quarantine or potential exposure, or anything like that, or even just people that were trying to just stay at home, they would call us, and then we would be able to refer them out to the emergency response. Later on, after we shut down that major operation, it evolved into a direct partnership with food pantries in the Capital District, where they would contract out with local pantries to do those deliveries. And at that point in the pandemic, it was only for people that we were putting on isolation and quarantine, not just anybody who was staying home for whatever reason. So there had to be a verification process with them to confirm that those were actually people that we had placed there. So so that's sort of the short version of it. I mean, there's a much longer version where we helped to kind of develop a set of referrals. We also provided almost like a self-isolation or quarantine kit for people, like when things were really blowing up in the fall, that we made available to sort of anyone in the community, especially through emergency response, because they were getting flooded with calls and things. So so we were sort of involved from day one, and then throughout kind of all phases there. And now we're still making referrals in that way for people, even though it's a much smaller number of people on isolation and quarantine, to be able to get those deliveries.
That's great. Thanks, Keith. Do any of the other panelists have anything to add or thoughts? Okay, that's great. Thank you so much. Just wondering too, how has your work during the pandemic changed the work that you will do in the future? Or if you could share tools that you will use in a non-pandemic world once we get there. Angela, should we start with you?
Our food pantry system that we created during the pandemic has really streamlined our process. And so I see that we'll continue to operate going forward. You know, our delivery system right now, for people who come to the pantry and shop, we're driving home their groceries. And we are providing bus passes for folks that would like one to get home so that they can meet up with the volunteer that's driving home their groceries. I'm going to, defer to our drivers when they're ready to actually, drive people and their groceries home. I'll let them wait till they feel comfortable. And I haven't really broached it with them. I feel like, right now we've got our system and things are going well, and no one seems to be complaining about not getting a ride home, given that we can provide a bus pass to them. And some of them live close enough that they can walk home, but they just can't, carry the groceries home. So I think we're going to keep things the same way right now until my volunteers want to change. They're the ones on the ground serving guests, and they're the ones that are, interacting with them. And so I really value their input and suggestions they have to improve our process.
That's great. Thanks, Angela. Patrick, what are your thoughts?
I think there's been a fairly large shift amongst county governments in general to kind of digital service provision, and that's both internally as well as kind of externally for public services. So that's kind of resulted in a lot of different workflows and processes, and really kind of transitioning to a remote work environment kind of resulted in the utilization of tons of different communications platforms. And those are all things that kind of are here to stay. And it kind of, I think this pandemic almost pushed county government from a technological standpoint, certainly into the 21st century. I'd like to, it's probably fair to say that a lot of the processes were significantly dated, and there was a lack of investment in a lot of technologies. And I think that that's probably something that's going to change kind of moving forward, and will change kind of over the next couple of years. but kind of just as a whole, kind of just embracing technologies is kind of a cultural thing that's certainly being driven at the top in Albany County.
That's great. Thanks, Patrick. What about in Schenectady County, Keith?
So I mentioned this kind of concept of things being low threshold before, but one of the things I think for us that we've learned across the board for emergency food delivery, for our public health work and everything else, is that you can't as you're developing new systems, you can't recreate systems that have been harmful or inaccessible or ineffective in the past. So we know that while there's a lot of safety nets that exist for people, it's certainly insufficient, but there are some. They're incredibly traumatizing to a lot of people. A lot of them are built on the same structurally racist and classist systems that sort of exist before. And so people find this experience of like constant re-trauma every time they go apply for another resource, every time they have to air their business out to another food pantry or resource or DSS or housing or whatever. And so for us, we're really trying to make things as accessible as possible for people without constantly traumatizing, re-traumatizing them. And so that's one of the things that we really learned and we heard from people when we were doing the emergency food assistance is, they were calling and they were saying like, you don't need any of my information. You don't need to, you don't need pay stubs. You don't need this. And we said, no, you tell us you need something, we're going to deliver things. And now I know that might not be sustainable for everybody long term, but I mean, it's sort of a world I want to live in where it is. If you're somebody in need and you call and say, I need something, that it shows up. And that to me starts to feel more like a robust safety net for folks. So I hope we take some of these lessons away. I think, Patrick's point about technology is huge. We learned that a lot of folks can work remotely. You know what I mean? And what does that mean for people? We also have learned things about the toll on people's mental health for something like this and emotional well-being. And so I think the long-term impacts of this are going to mean that we have to take these lessons forward. We have to be incredibly innovative. And probably even more so than that, we have to ground everything we do moving forward in the experiences, the wisdom, and the direction of the people who are closest to those issues. And unless we do that, I think we're just destined to keep recreating these systems that people don't want to use and don't really feel the need and constantly traumatizing.
Where do you start though, Keith? Where do you start with that? Because you're really talking about access and breaking down barriers. So where do you begin?
Yeah, sure. I mean, I think it's twofold. As organizations and as entities, like everybody has to look internally and talk to the people that you serve and really have honest conversations about probably more importantly about the people you don't serve who would be eligible for your services. Why don't they use their services? Figure that out. So there's internal work to sort of like decolonize a lot of that stuff and sort of figure that out. Think about how friendly your organization is physically for people to come, or is it accessible? Is a single mom with 3 young kids going to come use your service when she has to drag the kids, across town to come use it? And could we be flexible around that? Once she gets there, is she being treated in a way that makes it comfortable? So I think there's like internal work that needs to be done, and then we have to turn that outward and now look at kind of who are the people that fund, regulate, and otherwise, keep us from doing things the way we really need to do them. Just a brief example is, we clamored, for decades in the kind of substance use community around removing barriers to methadone and buprenorphine for people, right? So those are medications that are gold standards that work for people with opioid use disorder. And during the pandemic, those things finally were achieved because there was no other choice, right? So telemedicine and more take-home doses and less like lower threshold. And lo and behold, all the things that people were afraid that were going to happen, and it would be chaos and people would be abusing things, never happened. And so I think we have to take those lessons forward, and it's across the board. That's just one example, and say, what are the things we instituted? Did they work? Were they more effective for people? And why wouldn't we continue those and further examine how we can keep breaking barriers down? But that was soup to nuts. That had to go up through the regulatory body and down. And I think for food and emergency assistance, there's no reason why we couldn't critically examine all of those structures. And then I would also just say to really deepen the relationship with people doing mutual aid in the community. So in Schenectady, we have a robust network of food pantries, but we also have the 518 Free Store, which is like a real mutual aid effort where people, it's that low threshold stuff that I talked about before. And so how can we support the work that those micro organizations are doing, in addition to places that are well respected and well established like SICM, SCAP, and other places like in our county.
That's great. Thanks, Keith. That's great. And Tom, what are your thoughts on how has your work during the pandemic changed the work that you will do in the future?
Well, and I think piggybacking off of Keith, number one thing is accessibility. So when we started to do our winter delivery system, we found that we weren't so much hitting the places that were needed. And so what we wanted to find, and we did find that there was we were not aware of the amount of homebound, not elderly, especially through the pandemic. Everyone, was homebound and whatnot. But we really found that there was a need. There was a lot of, especially when we talk about accessibility, there was a need to get boots on the ground in areas that are high need. And so we were able to identify high need areas. So for us, as we progress, what we're looking at is, mobile pantries. Getting out and getting into those areas that we identified that had high rates of delivery calls, this, that, and the other thing, and partnering with other groups to get those mobile pantries out. So we, spent an afternoon with street soldiers down in Schenectady, and I mean, I was shocked by the fanfare. I didn't think that this was going to be something that people would laud, but they were very happy that SICM was getting involved in it. So that was exciting. That was one of those exciting turns that, hey, SICM can land something and we can get some traction on it. It was obviously a concern when you look for accessibility. Are we really being accessible? I think we were able to look internally as well, internally and externally. It's determine how we were treating, how we were serving. Were we doing with dignity? One of the accessibility aspects is, are you treating someone with dignity when they come to your establishment, when they come to your pantry? And that was a big thing for us. I mean, for me, coming from restaurants, it was hands down, you always have to treat people with dignity. It's just how it is, no matter what, or how they act, or how it goes on. And transferring that into the pantry model, how we serve. SICM has always prided itself as being a safe space. And I think that really furthered itself with the pandemic. We wanted to make sure we recommitted to that safe space type of service. We were not focusing on case management. We're not focusing on, trying to keep people in line, this, that. We just wanted to make sure if we needed something, we were there and we were happy to do it, and we were going to do it for you no matter what. And that takes a little bit of takes a real commitment by volunteers, by staff, and by management to really follow through and say, hey, it's Saturday at 7. I got a contract case tracer call. Okay, let's go do it. And I think with us internally, our staff really bound to that. I know our core staff here, we analyzed it, we looked at it, and we just felt it. We felt that that's what we needed. We needed to be far more accessible. We were excited to have new ventures. We were really happy to start, looking at the health aspect of what we're giving out. We wanted to make sure that we were giving out the right product And of course, it's a balancing act. I mean, someone can't live off of kale alone for 6 weeks. As much as we might think that that's the great way to do it, you need a little sweet. You need a little something. There's food for the soul. There's food for the body, and that's what we really that's what we're going to endeavor into. We're going to train staff in, when we return to choice, how to acknowledge and how to work with people to have a better choice, for them to have a better choice, but for them to have their choice. What can I do to source, say, halal meat, or various different types of fruits and vegetables, exotic things? What can I do? How can I help you? And so a lot of times now that the masks are kind of coming off in some ways, we can get outside and ask people, hey, what do you want? What do you need? How can we help you? And how many different ways can we help? So that's a big thing for us moving forward. Is we really want to enhance our accessibility, we want to enhance our healthier option, but we want to ask. We don't want to tell people, hey, this is what you need. We want to ask. We want to receive those answers and utilize them in a meaningful format. And I think that's where we as a pantry and SICM as the food justice initiatives want to be. We want to be in the position to ask and to receive. And so I think with our status, we can do that.
And that's great, Tom, too. And I think that speaks to what Katie Martin was talking about during the Fed talks as well, with creating this community hub where it is about inclusion. And, with that, really allowing for accessibility and to the removal of those barriers, because people really are invested in what you're doing. And by people, I mean the entire community. So those who are serving, those who might need a resource, but it is totally inclusion. So thanks for that. And then our last question, what are some of the resources or suggestions for those that want to learn more about creating partnerships with municipal government or charitable foundations? So Angela, why don't we start with you?
Well, I guess the first step should be inviting them to your pantry.
Mm-hmm.
I can't, that's a good way to start the relationship and to share what you do and, who you serve. I think that, there's, each pantry is different. Each community that a pantry is in is different, and it takes on that character. So I think people should just be, bold and invite, the mayor, the council people, the county legislators, and other public officials to check out the food pantry, and give them something to do. Have them come and unload your truck.
Angela's always good for that. She'll always be put to work
for somebody and deliver their food. I mean, I think that it might sound kind of, I don't know, hokey, I guess. I don't know. But I really think that you gotta invite them, because if you don't, the answer is they're not going to know what you're doing and who you're serving.
That's right. That's great. Thanks, Angela. Patrick, what are your thoughts?
Yeah, I mean, if there's any local governments listening on here, then the same goes for them. I mean, you got to ask as well. I mean, it's a two-way street. If you want the nonprofits and food pantries to be involved, then you got to ask. You have to involve them in planning. If there's any nonprofit in Albany County that wants to work with government and doesn't know a good entry point, go straight to the top. Reach out to the county executive's office, and I'm sure. I'm making a promise here today that somebody will get in touch with you and will follow up with you. So it's really about kind of just building relationships We've kind of gone more than almost a year and a quarter of COVID now, and we've certainly built relationships, but it's about continuing those relationships. And I'm certain that government elected officials, government departments are more than willing to work with nonprofits if called upon, and they should also reach out and talk to their community partners as well.
That's great. Thanks, Patrick. Keith?
I know we're at time, so I would just say center everything in the people with lived experience, the people closest to the issue, and then whatever you develop or whatever you implement is going to be way better from the get-go. And just like, everybody else said, talk to the people who've done it, ask them what lessons they learned, what they could have done better, what they would do over again if they could. But again, center it in the people, the people closest to the problem should be the people closest to the solution every time. And then it's always going to be better off for it.
Actually, I love that. The people closest to the problem are the people closest to the solution. That's awesome. Thanks, Keith. Tom?
Yeah, I'm right there with that. I think that this is one of the things that we found, right? Is that if we're not talking to you and you're not talking to us, then we're not going to get much done, and we're not going to get the right thing done. It's not going to be efficient. And we're excited to explore, down the road. What are our needs going to be if we do have another pandemic, if we do have another thing? Let's all get involved and make sure that we have these platforms set so that when it happens, it's not a shock like it was this time. And that's really the end of it. We were very happy to work with everyone, and I think that should continue.
That's great. As we close, I just want to thank our panelists for a very informative discussion and our audience for joining us. I believe we now have time for a lunch break and an opportunity to network. So to join a networking pod, please click on the link on the left-hand side of your screen entitled Networking Rooms, and then join the pod that is of interest to you. So thanks for being with us, and we hope you enjoy the rest of your day. Thanks so much, everybody.